Hey everyone, it's Sarah with RegisteredNurseRN.com, and today we're going to go over heart blocks. Today I'm going to go over 4 types of heart blocks. We're going to go over first degree, the 2 types of second degree, and the 3rd degree heart block. In my next video we'll go over the left bundle branch block, but just for today I want to go over these 4 types because they can be a little bit challenging, and I want to show you some easy ways on how to analyze those. I remember whenever I was in nursing school I had trouble telling the difference between second degree and 3rd degree. So here I have developed some easy ways on how to solve these rhythms, and they're little hallmarks, as I call them, because each rhythm has a certain thing you have to watch out for to make sure that it's the correct heart block. Now before we get started, I really recommend, if you don't know how to calculate the PR interval or to count the rate on a EKG strip or how to measure the QRS complex, I really recommend you check out those other videos I made, because you may be a little bit confused in this video, because in this video with heart blocks you have to really know how to measure the PR interval and look at those P waves. So you can check out those videos, a link should pop up and you can click and look at those. Now let's get started. Okay, before you solve any type of rhythm, you have to go over these 5 steps. These 5 steps help you to understand the rhythm so you don't get it wrong. For instance, say you have normal sinus rhythm. It looks like normal sinus rhythm. P waves are regular, R waves are regular, the rate looks good, but your PR interval is just a little bit long. And you wouldn't know that there was a first degree AV block if you didn't measure PR interval. So these 5 steps are just like safety checks, as I call them, to help you get these rhythms right. So let's go over those 5 steps real fast. First step you want to do whenever you're looking at your rhythm, you'll want to look at your P waves, make sure that they're present, and how many are there. Number 2, you want to make sure that your P waves are regular. In rhythms like atrial fibrillation, your P waves, you don't even have P waves, so they're not even regular. And in heart blocks, your P waves may be regular, they may be irregular. So you always want to make sure you're looking at those P waves. Step 3, you want to look at your R waves. This is part of the QRS complex. You're going to measure that with your calipers or a piece of paper, and we'll do that together in this video. And then you'll count to see how many are present. This is counting your ventricular rate. And in the other video I made, I showed you how to do that and how to calculate your atrial and ventricular rates. Also, are your R waves regular? Super important when you're looking at heart blocks as well. Because in some heart blocks, like 3rd degree, your R waves are regular compared to second degree type 1. The R waves tend not to be regular. So you want to always know how to do that and look at that in your rhythm. And step 5, the PR measurement. What is the PR interval measurement? And the width of your QRX complex. Very important steps that you always want to follow whenever you're solving your rhythms. So let's look at each of these 4 types of rhythms individually, and let's go over them and see how they're different. Okay, the first rhythm we have is first degree AV block. Whenever you're having a first degree AV block, what's happening is that the impulse is moving where your PR interval is moving slowly through the AV node without missed beats. So you have your QRS complex, but if you look at your PR interval, which starts here and here where these lines are measuring, it's delivering a very slow signal to your ventricles. So your AV node, remember from the other videos we went over the electrical system of the heart, your AV node is the gatekeeper. So the big deal with this rhythm is that your PR intervals are going to be abnormally long. A normal PR interval is less than 0.20 seconds. And this PR interval is 0.36. And I'll show you how to measure that here in a second. But that's what a first degree AV block is. Usually you're going to have this type of rhythm in well-conditioned athletes and the young. So it's not a bad thing to have. So let's go over our 5 steps. Okay, first step is our P waves present. And yes, we have P waves. That's what's in blue and those arrows are pointing at. And how many P waves are there? Remember, whenever you count your P waves, you're counting your atrial rate. So we have 1, 2, 3, 4, 5, 6. There's 6 within 6 seconds. This is a 6-second strip. And 6 times 10 is 60, so we have an atrial rate of 60. And we're going to see if these P waves are regular. This is so important whenever you're looking at AV blocks. So this is where you're going to use your calipers or a piece of paper, which I'm using. And we're just going to measure and see if our P waves are regular. And we're going to mark where this P wave is and mark where this P wave is, and then that's our baseline, and we're going to start measuring and see if it lines up. And it is lining up beautifully. So our P waves are regular. Very important, because in some of these other types of heart blocks, the P waves are not regular. And we're going to look at our R waves, which R waves are the QRS complex. That's the top spike. And yes, that's present. How many of them are there? There's 1, 2, 3, 4, 5, 6. There's 6, so we have a ventricle rate of 60. And let's measure our R waves and see if they are regular, because that's another important step in heart blocks, because some heart blocks, their hallmark thing is that the R waves are not regular. So we're measuring, and they are definitely regular. So really, to the typical eye, if we just stop there, you would say, hey, I got sinus rhythm, but we got to go to our last step, step 5. And that is where we look at the PR interval measurement and the QRS width. But we're really concentrating on the PR interval. So probably on the video you can't see as well, but I've tried to highlight it out, these little boxes. Whenever you're counting the PR interval, you're counting at the beginning of the P wave to the beginning of where the QRS complex starts. And you're counting these little small boxes. Remember, each small box represents 0.04 seconds of time. And a normal PR interval is less than 0.20. So let's count and see how many small boxes we have. We have 1, 2, 3, 4, 5, 6, 7. We have 9. We have 9 small boxes. So 0.04 times 9 is 0.36 seconds. So our PR interval is very long. So this is a first degree AV heart block. The key with remembering your first degree AV heart block is everything's going to look normal. You're going to have QRS complexes, you're going to have P waves, they're going to be beautiful together, but the little underlying thing is that your PR interval is going to be long, and they're all going to measure the same in width. Okay, now let's go over second degree type 2, also known as a Wenckebach. Now let's go over second degree type 1. This is also called in the clinical setting, you may hear nurses or doctors refer to a Wenckebach or a Mobitz I. A lot of times this is called a Wenckebach, but it's also another name for second degree type 1. So with this, we are going to go over our 5 steps, because remember, going over the 5 steps really help you determine what the rhythm is. So we are going to ask ourselves, are there P waves present? And yes, there are P waves. P waves are in blue. And how many P waves are there? You're going to count in the 6 seconds. There's 1, 2, 3, 4, 5, 6. There's 6 P waves, so 6 times 10 is 60. And you're going to look and see if your P waves are regular. This is really important whenever you're starting to get in these other type degree heart blocks, because your P waves won't be some of them will not be normal like they were in the first degree AV heart block. So let's measure this. Typically, whenever you're doing heart blocks, it's really, really good to get your calipers, but if you don't have calipers, the paper will work. But usually the P waves will be so slightly off that the calipers are a little bit more accurate. But if you have to use paper like me, you just have to use paper. So we're going to measure those real fast, and they are going to be slightly off. And they are, as you can see, and so our P waves are irregular, and we're going to look at our R waves. We have R waves are right there. That's your QRS complex. And let's count how many are present. 1, 2, 3, 4, 5. There was 6 P waves, and there's only 5 R waves. Right here there was 1 drop. So you have a rate of 60 for your ventricle rate. And are the R waves regular? So let's measure those out. And our R waves are most definitely not regular. So no. We're going to look at our PR interval, and you can just even tell by just looking at this that your PR intervals, remember you measure right here to the beginning of the QRS, are definitely lengthened. You can measure that out. It looks like it's greater than 0.20. And our QRS looks good. Now, with second degree type 1, you have to remember these PR intervals are cyclics. What I'm talking about, look at this. Here's your PR interval. Here, see this line? And then look, you go to your next PR interval. Notice it's a little bit longer than this one. Now let's go to our third PR interval. See, it's longer than this one and this one. And notice how it's slightly getting longer and longer. And then all of a sudden you have a P wave, and then look, it's disappeared. No QRS complex. Then it starts all over again. Looks a little normal, and then it starts lengthening out again. And if this rhythm went on, you would see that cycle. So the big thing, you will not see this with any other heart blocks, is this cycle of this slowly lengthening of each PR interval. And this is the big hallmark of this rhythm, a Wenckebach. You will see the lengthening, and then you'll see all of a sudden a drop QRS complex, and then you'll see more lengthening, and then another drop QRS complex. So it's a cycle. Now let's go over second degree type 2, and then we'll compare them to each other. Okay, we're going over second degree type 2. This is also called Mobitz II. Usually it's referred to second degree type 2. Now, a lot of people get second degree type 2 and second degree type 1 confused, but there is a huge difference, and I'm going to show you why. Okay, let's go over our 5 steps. P waves. Are P waves present, and if so, how many? We have P wave here, 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 there, 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 and there. And how many was that? There was 1, 2, 3, 4, 5, 6, 7, 8. So we have an atrial rate of 80. Look at our P waves. Are they regular? Super important to measure and see if your P waves are regular. So let's look. And they are absolutely regular. Now, whenever you're looking at your heart blocks, one thing that a lot of people make an error of doing, you have to pay attention to these T waves and make sure that you're not measuring them as P waves, because sometimes they can get really confusing. So always make sure you're measuring out what P waves are and what T waves are. See, these are T waves right here. Typically appears behind the QRS complex, and your P waves are before your QRS complex. So always make sure you're doing that. So our P waves are regular with this. Now we're going to look at R waves. In red, those are your R waves. And we have 1, 2, 3, 4, 5. So we have a ventricle rate of 50. And we're going to measure out our R waves. And as you're going to see, our R waves, they're very regular, because where'd they go? Right here, they're missing. There's no ventricle depolarization, so we don't have a QRS complex. So we're going to go over here, and these seem to measure equally, but because these are dropped, you would call this irregular. So the big thing with second degree type 2 is that your P waves are going to measure beautifully. They are going to be regular, but your R waves are going to be irregular. So all of a sudden you're going to have a beautiful P QRS complex, and it's just going to be beating along, and then all of a sudden you're going to have a P wave, but you're not going to have a QRS, and it might happen again. And this is not cyclic at all. There is no cycle. You're not going to see any pattern, any repetition like how you do with second degree type 1, the one we just covered, because that's a big thing of how you can tell the difference between these two. So again, your P waves are going to always measure regularly, but your R waves are going to be irregular. Now, the PR interval. Typically in a second degree type 2, the PR interval can be normal. And as you can see with this, it is normal. So it can be normal, it doesn't have to be abnormal. So the big thing you need to take away from this is that you're all of a sudden you're going to have PQRSs beating along, and then all of a sudden you're going to drop your QRS complex, and it's going to have regular P waves and abnormal irregular R waves. So let's compare the first degree and the second degree type 2 just together on the camera, because I want you to see the difference. Okay, I really wanted to go over this difference because a lot of people, because it's a second degree type 1, second degree type 2, they really get them confused. So let's just look again real quick. Remember, second degree type 1, you're going to have the cycle patterns of your PR intervals slowly getting longer and longer, and then bam, it drops a QRS complex, and then the pattern repeats itself all the way over. And the second degree type 1 is known as Wenckebach. Now, second degree type 2, you are going to have PQRSs, and it's not going to be cyclic. Your PR interval can be normal, and then all of a sudden you're just going to drop a QRS complex randomly. And the hallmark with that are that your P waves are going to be normal. They're going to be regular when you measure them out, but your R waves are going to be irregular, and it's known also as a Mobitz II. So now let's compare the third degree heart block and look at that and see its difference, and then I'll compare the second degree type 2 with the third degree heart block, because sometimes people get those two really confused. I know I have in the past. Okay, this is a third degree heart block. This is also known as a complete heart block. This is not good. As a side note, if you have second degree type 2, the rhythm we just went over, they can easily progress to the third degree heart block. And whenever that happens, they need intervention, because this is not good at all. Because what's happening is that your atriums and your ventricles are completely independent of each other. They're not synced together, and they're not beating together. They're just doing their own thing. So that's a hallmark of the third degree. So let's go over the 5 steps and looking at this, because it looks funky and you can tell there's something definitely not right with this patient. So, are there P waves? Yes, there are P waves. P waves are in blue. This is really tricky sometimes, because you will have, like, remember a T wave, but your T wave and P wave may be together. So you really have to watch out for that as well. So here's your P wave, P wave, P wave, P wave. There's another one, there's another one, there's another one, there's another one. And we'll count them to get an atrial rate. We have 1, 2, 3, 4, 5, 6, 7, 8. An atrial rate of 80, and we're going to measure our P waves. With this rhythm, I want to point this out. Your P waves and your R waves will both be regular. Now let's compare that with second degree type 2, the one we just went over. Remember, the P waves in that rhythm were regular, but the R waves were irregular. So that is a big difference of how you can differentiate between the two, because I would always get those two messed up in nursing school. So let's measure them out just to prove that they're regular. Okay, very regular, beautiful. And then let's look at our R waves. And remember, R waves again were not regular in second degree type 2, but they are here. They're regular. And we are going to look at our R waves. We have 3, we have a ventricle rate of 30, not good. And our PR interval, it's very abnormal. It's all over the place. Here's a P wave. Actually, you really can't even measure the PR interval, because your P waves are not with your QRS. Remember, they're beating independently, so that's not even an issue. So with third degree heart blocks, I'm going to say it again, your P waves are going to be nice and regular, and so are your R waves. But you're just going to have random P waves here, and then all of a sudden you're going to have a QRS complex, and they're not related like how the normal PQRS complex is supposed to be. And remember, if your patient's in this is bad and they need intervention. So let me show you on the camera type 2, second degree, and third degree heart block together, so you can just see the difference. Okay, here they are side by side each other. And like I said, I had trouble differentiating between these two, because they are a little tricky, especially when you're dropping the QRS complexes with the P waves. But remember, the key between these two is that the second degree type 2, your P waves are going to be regular. When you measure those out with the calipers, they're going to be regular. On third degree, they're going to be regular as well. But your R waves is the defining point between these two heart blocks. Your R waves in second degree type 2 are going to be irregular. And in third degree heart block, your R waves are going to be regular. Okay, so always remember that. Now let's take a quiz, and I'm going to have 2 blank rhythms, and you can tell me what they are, and we'll go over them together. Okay, here is our first quiz question. If you want, you can pause the video and look at it and analyze it, because here in a second I'm going to go over the 5 steps with you, and we're going to solve it together. Okay, so very first thing we want to do, we're looking at the rhythm, and of course it looks, hey, something's abnormal. We got P waves all over the place. We got missing QRX complexes. We know that something's funky about it. I'm thinking heart block, but in order to solve it, let's do our 5 steps together. Okay, let's look at our P waves. We have a P wave here. We got a P wave there, there. Let me mark these real fast. We got one here, we got one there, there. One there, no QRS complex. We got another one there, no QRS complex. We have another there, QRS. That is a T wave. There is P wave right there, QRS complex, that's a T wave, and that's our P wave, and that is a T wave over there. So let's count how many P waves we had. We had 1, 2, 3, 4, 5, 6, 7, 8. We had 8 P waves. So we have an atrial rate, I'm going to write it right here, of 80. And we're going to see if our P waves are regular. So let's measure these out. And our P waves are looking regular. So we know that our P waves are regular. So I'm just going to write right here, P waves regular. Now let's look at our R waves. How many R waves do we have present? We have 1, 2, 3, 4, 5. So we have a ventricle rate of 50. And we're going to measure and see if our ventricle or our R's are regular, which looking with the naked eye, definitely not, but we're just going to measure them out anyways. And we're missing some, so they're absolutely not regular. So our R waves are irregular. Now, remember what we've just learned. I'm starting to think that this is definitely not a 3rd degree complete heart block. Because why? The reason it's not is because remember, your P and R waves, they were both regular. So this isn't cyclic, okay? We're not having a cycle where our PR intervals are slowly lengthening and then all of a sudden they drop. There's definitely not a cycle. PR interval looks normal. It can be normal with this type of degree heart block, and this definitely isn't 1st degree because remember, 1st degree looks like sinus rhythm, but you have the lengthening of the PR interval. So the only thing that leaves us with is 2nd degree type 2, Mobitz II. So we have a 2nd degree type 2 heart block. So that's what that is. Now remember, you can go to my website, RegisteredNurseRN.com, and I have all these rhythms and you can test your knowledge on this as well. So let's do our last rhythm. Here is our last rhythm. Just looking with the naked eye, I would interpret this, hey, I think this might be sinus rhythm. It looks good, everything looks nice and regular, but we know it's not since we're going over heart block. So let's go over our 5 steps and see what we got. Let's look at our P waves. Very first thing we'll do, we have a P wave here, got a P wave there, there. Remember P, QRST, P, QRST, P, QRST, P, QRST. So it looks like we have the right amount of P waves with right behind QRS complexes, so that's looking good. So let's see if our P waves are regular. That's our next step. And our P waves are definitely regular, so let's write P waves regular. And let's count our P waves real fast. We have 1, 2, 3, 4. So we have an atrial rate of 40. And let's look at our R waves. We have 1, 2, 3, 4. We have ventricle rate of 40. Let's measure our R waves. My paper's running out. There we go. R wave here, R wave there. And our R waves are definitely regular. So we know right now that our R waves are regular, P waves are regular. It's looking pretty good, almost meeting sinus rhythm criteria. But let's do our last step where we're going to measure the PR interval. On the camera, you may have difficulty seeing this. So I'm going to try to mark it so you can see whenever you're measuring PR interval. If you're not familiar with this, please take the quiz on my website how to do it, or check out the other video I made on how to do that. So remember, you measure at the beginning of the P wave and the beginning of the QRS complex, and you count these itty bitty little squares. So there's 1, 2, 3, 4, 5, 6, 7, 8, and there's one right there, 9. So there's 9 of these little squares. Now, each square, remember, is a measurement of time. It represents 0.04 seconds. So 0.04 times 9 is 0.36 seconds. And we know that a normal PR interval is less than 0.20, so we definitely have a really long PR interval. This is not normal. In normal sinus rhythm, you do not have this long of a PR interval. So we know that we definitely have a 1st degree AV heart block. So why do we not have a 2nd degree heart block? Type 1, a Wenckebach. We do not have that because we don't have the cyclic lengthening of the P waves like how we would in that rhythm, so don't have that. Why is this not a second degree type 2? Because we have QRS complexes, they all match up, we don't have any dropped, and our R waves are regular. Remember, in a second degree type 2, your R waves are irregular. And why is this not a third degree heart block? This is not a third degree heart block because you have your atriums and your ventricles beating together. They're all in a nice little set. You just don't have random P waves and random QRSs. So that is why this isn't a complete heart block. It is a first degree AV heart block. Okay, so that is how you go over heart blocks. I hope I helped you with that. I hope I increased your knowledge with it. Now go to my website, RegisteredNurseRN, and take that quiz and see how well you grasp this material. Thank you so much for watching, and please check out my other teaching tutorials and subscribe to this YouTube channel. Thank you.